Alright, welcome back to Chapter 7, Anatomy and Physiology and Medical Terminology. One of the most important chapters of this text. Knowing the human body is very, very important and how it works. Alright, some overview, anatomical terms, body systems, and medical terminology. It's going to be sort of a lengthy chapter. I was going to do it in two parts, but I decided to keep it in one. Alright, we always begin with a case study. EMTs Kevin Henderson and Tom Armstrong have just arrived on the scene of a patient with multiple stab wounds. Law enforcement has secured the scene, allowing Kevin and Tom to approach the patient, a man in his 20s. Kevin notices immediately that the patient appears to be unresponsive, with pale skin. His shirt and the upper portion of his pants are saturated with blood, and blood has started to pool on the floor around the patient. Tom reports that the patient has a weak carotid pulse and begins managing the patient's airway and ventilation. Cutting away the patient's clothing to determine where he has been stabbed, Kevin sees 2 stab wounds to the left side of the chest, a stab wound to the upper right abdomen, stab wound to the right groin, and several cuts on the forearms and hands. What organs may have been injured by the stab wounds? What are the consequences of injury to each of these organs, or those organs? And what terms will Kevin use to describe the exact location of each wound? Take time and pause this and write these questions down so that you can answer them throughout the lesson. Alright, our introduction. Knowledge of the human body is required to assess and care for patients. Anatomy refers to how the body is made. Physiology refers to how the body works. Medical terminology allows for concise communication. Here we go, some anatomical terms. The anatomical position is standing, facing forward, arms at the sides, and palms facing forward. Positions of the body: supine, which is laying face up or lying face up. Prone, lying face down. Lateral recumbent can be the left or right side. The Fowler's position, sitting upright. The semi-Fowler's position is sitting upright at a 45. The Trundleberg position is head down, feet up. And then there's also the shock position. And there's supine, the prone. This is the right lateral recumbent, but you can also be in the left lateral recumbent. And there we go, left lateral recumbent. The Fowler's position. The shock position, feet elevated. Or Trundleberg. Now the semi-Fowlers, you might want to lay them back just a little bit for that. Which statement on the left best describes each term on the right? Click on the terms to check your answers. Lying in a position face down. If you chose prone, you would be correct. Lifting the arm out to the side, away from the body. Away from the body. I know we haven't covered this yet, but use your best guess. If you chose abduction, you would be correct. Lying on the side. If you chose the lateral recumbent, you would be correct. And bending an extremity toward the body obviously leaves us with flexion. Alright. Body systems. The respiratory system. The respiratory system structures: airway, the lungs, and diaphragm. The lungs and diaphragm are organs of respiration. They contain thousands of microscopic alveoli covered by pleural linings. diaphragmatic muscles. And here we go is the upper and lower airway. Now we have to remember we have an upper airway and a lower airway. That's going to become important later on in the class when we start talking about patient assessments and your knowledge of the anatomy and what could possibly be wrong with the patient. The upper and lower airway obviously is separated by between the larynx and the trachea right here. This begins your lower airway, and this is the end of your upper airway. So our upper airway, all right, we have our nostrils. We also have our mouth, our oropharynx. When we take something orally, we take it by the mouth. And then we have our nasopharynx. And they meet, the naso and the oropharynx meet at the laryngopharynx right here. And then a little bit further down, you have the larynx. Okay, that is your upper airway. Your lower airway consists of your trachea here. The bronchus is the fork in the road for the trachea. One goes left, one goes right. The bronchus, which split off into what we call bronchioles on both sides. And at the very tip of the bronchioles we have alveolus, or alveoli, which is a bunch of them. These are our blood vessels. On the left you see a normal vessel, smooth muscle with normal tension. The smooth muscle is that inner lining of the vessel which causes it to constrict and dilate. Vasoconstriction, you'll hear vaso or vasoconstriction throughout this class a lot. That smooth muscle is constricted. That's what causes a vasoconstriction. And then vaso or vasodilation, the smooth muscle is relaxed, which causes that blood vessel to dilate. Okay, the pleural linings of the lung. You have the thoracic wall, which encompasses your ribs, intercostal muscles. Here's your bronchus and your lungs here. Then we have the trachea, and then we have the parietal pleura here between the chest wall and the chest wall and the pleural space, and then the visceral pleura, which is going to be wrapped around the lungs itself. Okay, so that parietal pleura, which protects the lung itself from the chest wall, the ribs, and the muscles, and it also has another protective layer called the visceral pleura, which is attached to the lungs. If you ever heard anybody have a condition pleurisy, pleurisy is an inflammation of the visceral pleura or the parietal pleura, and it just constricts the lungs. It's painful. Could sometimes feel like you're having chest pains, like in a heart attack or something like that. Okay, a normal and constricted bronchiole. Remember what the bronchioles are. They branch off from the trachea at the bronchus. And what you see, this little netting around here, is smooth muscle. Okay? And we have a normal bronchiole. It's not constricted. It's not dilated. It's normal size. Air moves in and out. Over here we have a constricted bronchiole, which squeezes off the inside right there, causing inflammation. And just so you know, there is a little bit of mucus and moisture inside your airways at all times. Otherwise, we'd have a very, very dry cough all the time. But when you see it squeezed here, it's pushing all that mucus out, just kind of making it, there's not enough space in there, so it looks like it's clogging up. Okay, so anatomy in infants and children. This picture says it all, really, if you look at the way the animated airway looks as they're laying supine. The child has a smaller nose and mouth as an adult. In the child, more space is taken up by the tongue, because the tongue is one of those muscles that doesn't really grow over time. It kind of comes in this world. Excuse me. When we get a certain age, it stops growing, and it stays that way until we're adults. So kids usually have the same size tongue as adults do. Not exactly, but close to it. Which takes up a lot of space in their airway, which is small. Their mouth, which is smaller than ours. Okay, the child's trachea is narrower, smaller. The cricoid cartilage is less rigid and less developed. So if we look at that cricoid cartilage right here, that is the cartilage. It's your Adam's apple. For those of you who don't know medical terminology yet, that is your Adam's apple. And the airway structures are more easily obstructed because it is narrower, because it is not as strong. It's more pliable. It can collapse a lot easier. And I also want you to look at something right here that's not described in this picture. Is we look at that, how it bends a little bit. And if you look at an adult, it's more straight. They're laying in the same position, bending in the child, straight in an adult. That's because kids have big heads. I'm just going to be honest with you. And his head is pushing up and causing this to bend forward. It's not necessarily constricting his airway. The tongue could be constricting his airway at this point, which we have devices to move that. But we could take some towels or some sheets and place those underneath his shoulder blades, which will raise his thoracic cavity up, cause his head to tilt back, and straighten that airway just like this. So you'll see me talk about it. You'll see me talk about it later on in the class, where we talk about padding a child to open their airway. Okay. All right. The mechanics of ventilation are inhalation and exhalation. So we inhale and exhale, and then we have diaphragm and intercostal muscles that help us do that. On the left, you see airflow going into the trachea, which causes that space in our thoracic cavity to grow, or to get less. More space is taken up. And as you can see, the intercostal muscles contract and pull the ribs outward and upward. Okay, and as the lungs expand, you can see all the arrows showing which way it goes. The diaphragm contracts and moves down and outward. You can see here. Now, remember, when we inhale, all of our muscles in the thoracic cavity, our intercostal muscles and our diaphragm, are contracting. They're like if you were curling a weight with your arm, your bicep muscles would contract. That is the same thing that's happening here, except you're not curling, you're breathing in. So your intercostal muscles and your diaphragm are contracting to pull in the direction that it needs to go. All right, so just the exact opposite in exhalation, or they call it inspiration and expiration. We inhale the air and exhale the air. You see the airflow going out of the trachea here. Those intercostal muscles are going to relax, and that diaphragm is going to relax. The intercostal muscles are going to move the rib cage back to its normal position. And the diaphragm relaxes and moves upward, which when that happens, because the lungs are recoiling back to normal, or their resting state, the ribs and the diaphragm have to move back to their normal state, because we don't want to have any extra space in the thoracic cavity. All right, the physiology of respiration. Oxygen and carbon dioxide exchange in the alveoli. It's very important when we talk about gas exchange. Carbon dioxide and oxygen exchange in the peripheral capillary beds, okay? The peripheral, when we talk about peripheral, we talk about away from. So we think about, just say, our fingertips. We have capillary beds in our fingertips. We have capillary beds all over our body where oxygen and carbon dioxide exchange with each other, and we're going to get more into that. Okay, here's an alveolar / capillary gas exchange. If we look at the arrows, we see the oxygens coming into the alveoli. That means we are inhaling oxygen, and then oxygen comes down, and so this alveolus is very permeable, and so is the capillary. So you see the capillary, the blue, the purple, and the red. That is a blood vessel. Okay, and the oxygen comes in and exchanges. Oxygen will pick up. So let's start over here before I confuse you. Blood from the right side of the heart enters the pulmonary capillary. That means blood from the right side of the heart is deoxygenated blood and has low levels of oxygen. So we were going to say no oxygen coming from the right side of the heart. The blood from the right side of the heart, no oxygen whatsoever. Okay, so it's coming down to the alveolus where we breathe in oxygen to pick up oxygen. So that deoxygenated blood comes from the right side of the heart, gets here, and it picks up oxygen from the alveolus. But at the same time, well, you see these little cells in here, these are red blood cells. At the same time, this deoxygenated blood has high levels of CO2, so it gives off the CO2 in the alveolus to go back out of the airway. Remember when you were taught when you were a kid, you breathe in oxygen and you breathe out carbon dioxide. And this is where it happens. This is exactly how it happens. Oxygen comes in the alveolus into the capillary. The capillary deoxygenated blood dumps off that CO2. We breathe in the oxygen and we breathe out the CO2. Then the oxygen attaches to the hemoglobin in the blood. Now the blood has high levels of oxygen and low levels of CO2, and then the blood leaves the capillary and it is transported back to the left side of the heart. Something you need to pay attention to. Over here, right side of the heart, no oxygen. Blood on the right side of the heart contains no oxygen. Blood on the left side of the heart contains oxygen. This is very important when we talk about how the blood flows through the heart. If you have any questions about this and how gas exchange occurs, and we will cover it a lot more, but if you have any questions, please send me an email. Again, just another picture. Well, it's a different picture because this will be your peripheral capillary beds. Now we're talking about after this, let me go back. After this oxygenated blood goes to the heart, it is pumped out to the rest of the body. And now here's the rest of the body, our cells and the rest of our body. So that oxygenated blood is from an artery. Low levels of CO2, high levels of oxygen, enters that capillary bed through that arterial. And O2 is given to the cells, and the cells are like, hey, we don't need this carbon dioxide, take it back. And it's, well, basically carbon dioxide and waste, and the blood picks up that carbon dioxide as it dumps off that oxygen and takes it back through the veins, or the venule to the veins. And this is just more cells. There's not separate things going on in each one of these 4 cells. They're all doing the same thing. But remember, oxygen through the artery to the capillary, dumps it off into the cell, picks up CO2. Now that CO2 is being transported through the blood through a vein. So arteries carry oxygenated blood from the heart. Every blood vessel that takes blood away from the heart or carries blood away from the heart is an artery. Everything that carries blood to the heart is a vein. Remember that. Everything that carries blood away from the heart is an artery. Everything that carries blood to the heart is a vein. All right. Adequate and inadequate breathing. Adequate defined as adequate tidal volume and respiratory rate. Adequate respiratory rate in an adult is average 12 to 20 times per minute. That means you inhale and exhale, counted as one repetition, 12 to 20 times a minute. In the elderly, it is averaged at 20 to 22 times a minute. Now we're going to get into tidal volume and respiratory rate a little bit further. An adequate respiratory rate in children is 18 to 37 times a minute, and in infants is 30 to 60 times a minute. Pay attention to those numbers. They are high. If you ever try to keep up with breathing with an infant, you will probably hyperventilate. Why can they breathe so fast? Because their lungs are a lot smaller, and they're not taking in as much tidal volume as you are. In adequate breathing, we need to be looking for a regular rhythm. That means breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, not breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. That's irregular. We want it constant, just like a metronome. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, that sort of thing. It should be effortless. Remember, our lungs are autonomic. That means we do not have to tell ourselves to breathe. They're just going to work on their own. And it should be effortless. There should be no effort in breathing. We have to make sure the chest expands adequately. That's why we expose the chest whenever we do our trauma assessment, our medical assessments. We expose that chest to see if both sides of the chest and all areas of the chest are expanding adequately. We should hear no abnormal sounds when we use our little stethoscope, because I know that's why you all took this class, so you can carry a stethoscope, right? Just kidding. But you take your little stethoscope and you place it on the thoracic cavity in the areas that I'll show you later, and you should hear no abnormal sounds. You should also hear no abnormal sounds without a stethoscope. And we should also see no use of accessory muscles. The only muscles that should be using in breathing are intercostal rib muscles and the diaphragm. Anything else is an accessory muscle. Inadequate breathing. The rate is too fast or too slow. And you think, well, I don't know, man. Slow breathing isn't bad. Well, if it's too slow, it could be very bad. Remember, we have to take in enough oxygen to keep our blood filled with oxygen, our cells filled with oxygen. And if we're breathing too fast, we're going to be missing some oxygen. If we're breathing too slow, we're going to be missing some oxygen. An irregular rhythm. I just explained that to you on the last slide. Diminished or absent breath sounds. So when you listen with your stethoscope, you can barely hear or you don't hear any at all. That's not a good thing. Unequal or inadequate chest expansion. Pale or blue skin or mucous membranes. This is going to be a sign of low oxygen. And we'll talk about the name of that and what that condition is called later. Agonal breathing is gasping sporadically. That is not normal breathing. You should have learned in your CPR class that agonal breathing is not normal, and you should not count that as regular breathing. All right, back to the case study. Kevin's assessment of the patient's breathing reveals respirations of 30 per minute that are shallow. Breath sounds on the left side of the chest are diminished and in comparison to those on the right side. Are the patient's ventilations adequate or inadequate? And explain your answer. How are the patient's injuries affecting his body at the cellular level? Take time, pause that, write these down so you can answer them. Okay, body systems. The circulatory system. Circulatory system is a closed system to transport blood, nutrients, oxygen to all tissues of the body. Keyword, closed system. That means arteries and veins are broken. That is not a good thing. Blood should be contained inside the circulatory system and not anywhere else. It removes any waste product from tissues. It's comprised of the heart, blood vessels, and blood. I can guarantee you that will be on a test. And here we go. It's a picture of the circulatory system. It shows you the heart, and then it shows you a picture of an artery, a vein, and the capillary. Remember, arteries carry blood from the heart or away from the heart, and veins carry blood to the heart. And capillaries are where oxygen and CO2 is exchanged. All right, the basic anatomy of the circulatory system. The heart has atria and ventricles, and atriums and ventricles. It has 2 atriums and 2 ventricles. It has 2 valves, the tricuspid and bicuspid, 4 valves. The tricuspid and bicuspid valve, and the pulmonic and aortic valve. This picture right here, and I put it in the class drive. Please, 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 please learn this picture. I can sit here for an hour and explain to you how the blood flows through the heart. I'm not saying for sure, hint, hint, there may be some assignment that you have to do to explain how the blood flows through the heart. But it has labeled everything for you, and it has shown you blood comes from the body, here, to part 1, then to part 2, 3, 4, 5, and 6. Follow those steps and you'll see how the blood flows through the heart, and it will explain each one of them to you. So please, please, please learn this picture. It is very, very important. You will always, 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 always need to know how blood flows through the heart. The arteries consist of the aortic artery, coronary arteries, carotid arteries, femoral arteries, and arteries of the arms and legs. The red that you see in this picture are the arteries, and the blue are obviously the veins. We also have coronary arteries. They are to supply blood to the heart itself, nowhere else. Nowhere else. And you can look at this picture and you can see the description of each one. You're going to learn right here, this is the aorta. This is where the blood leaves the heart and goes to the body. And you can see that the right and left coronary arteries branch off from the aorta as soon as blood is pumped out. It's got that, it's the heart, so the heart gets the freshest of the fresh, so to speak. Okay, capillary beds connect the arterial to a venule. So basically you have arteries and you have arterioles, which are a little bit smaller, and the capillary, and you have veins and venules that are a little bit smaller. So the capillaries connect the arterioles and the venules together. And they are the site of gas exchange at the cellular level. The venous system consists of the venules, veins, the vena cava, and the pulmonary veins. All very important that you will have to know. All right, sorry about that. All right, again, the cardiovascular system. Now here's a breakdown of the arteries, capillaries, and veins. If you look at figure A, you see the artery. and you can see, well, in figure C, you can also see the vein, but you can see that they contain most of the same thing as far as structure goes. External elastic membrane, smooth muscle, internal elastic membrane, and then lumen, and then the endothelium. So everything is the same except veins can contain a valve. And the reason for that is because most of the blood traveling through a vein is going up. And we all know the law of gravity. Okay? So if the blood is going up and back to the heart, then if we didn't have these valves to catch it at certain spots in the vein, then it would all just sink back down and we would be all swollen in our lower extremities. So that's something to think about. And at every pump of the blood, it shoots up through the valve and it stops. The heart pumps again, shoots up through the valve and stops. So it's kind of taking little steps at a time. And then we have the capillary, which is just endothelium, and you can see how permeable it is. Permeable meaning that it is very thin and things can travel through it. All right, cardiac conduction system. This is very important to know as well. So you have the superior vena cava from the word vein, and down here is the inferior vena cava. We'll get into the superior and inferior later. Superior meaning above, inferior meaning below. But if you see number 1, you see the sinatral node, and it's pointing to this little yellow dot here with these little branches from it. This is the pacemaker of the heart. So if you ever get a question on the test, what is the heart's pacemaker? You know it's the sinatral node, or we call it the SA node. Okay? And then you have the internodal pathways, which is those yellow branches I was telling you about. And they connect to the next node, which is the atrioventricular node, or what we like to call the AV node. So the electricity from the heart, the electrical impulse from the heart starts here, goes through these pathways, the internodal pathways, to the AV node, starts at the SA node, through the internodal pathways to the AV node, and then it is sent through, you can see the conduction system here. This is the atrioventricular bundle, or the bundle of His. That's right, HIS, His. And then you have bundle branches, which go down the ventricles here. And then these little things that go back up the ventricles are called the Purkinje fibers. The Purkinje fibers. Now, what's going on here, you say? This looks like some kind of vessel. It is not. It is an electrical pathway. The SA node gives a beat, causing the atriums to contract, and then sends the electrical impulse to the AV node, causing the ventricles to, causing the electrical signal to go through the Purkinje fibers and the bundle branches, and which cause the ventricles to contract. You need to know this as well. Very, very important. Okay, composition of the blood. The blood has red blood cells, white blood cells, platelets, and plasma. The physiology of circulation. Assessing the pulse and blood pressure gives information about the adequacy of circulation, how adequate circulation is. The pulse is created by a wave of blood propelled by contraction of the left ventricle. Now, what I want you to understand is we all take a pulse. Usually you had your pulse taken, or if you've even taken a pulse on someone, you use the wrist, right? The radial pulse is what that's called. Why do we go way out there when we could just stick our fingers in their neck? Well, for a couple of reasons. Is because if we can get a good pulse at their radial pulse, which is a very distal peripheral pulse, then we know that heart's pumping pretty good towards the center of the body, because it's sending a very, very good signal all the way out to the wrist or the radial pulse. And we also want to, we can also check the femoral pulse, which is a central pulse, but also a pedal pulse, which is right at the top, what's called the dorsalis pedis. top of our foot. We have a pulse down there as well, of course, because blood flows down all the way to our toes. And those are distal peripheral pulses, and if we have good pulses there, then we're doing pretty good. Or our patients are. Okay, the physiology, I can't talk. The physiology of circulation, the central pulses are going to be your carotid, which are in your neck, one on each side because we have 2 carotid arteries. And then femoral, which are one on each side because we have 2 femurs, 2 femoral arteries. Our peripheral pulses are radials, which I talked about earlier, the wrist. Brachial, which is in between the shoulder and the elbow, underneath the bicep muscle. Posterior tibial, that is behind your knee. And the dorsalis pedis, which is the one on top of your foot. Okay, blood pressure is the force exerted on the walls of the arteries as blood passes through. On the walls of the arteries as blood passes through. We have 2 readings that we use for blood pressure, the systolic and the diastolic. The systolic blood pressure is when the blood is pumped from the heart through the aorta into the arteries. That is the pressure that is put on the arteries at that time, the systolic blood pressure. And then we have the diastolic, and that means whenever after that pressure relaxes and the blood vessel goes back to normal, that is our diastolic pressure. The physiology of circulation, hydrostatic pressure is the force of fluid within the blood vessels and is determined by the volume of blood. Elevated hydrostatic pressure can be detrimental. It can bust a blood vessel. Okay, so the effects of hydrostatic pressure on a vessel. We have on the left the arterial going into the capillary right here. The plasma proteins escape the permeable capillary. Also water is drawn out and then it goes back to the venule. So we don't want the plasma and water. Some of it's going to escape, but too much hydrostatic pressure is going to cause a lot of it to escape, and we don't want that. If you think about a lot of water escaping from here, you might be thinking about dehydration, things like that. Okay, so perfusion and hypoperfusion. Perfusion and hypoperfusion are some words that you're going to have to remember, and you're going to have to know what they mean, because I'm going to say them a lot in class. I'm not going to make it a practice of saying medical terms and then explaining the lay term to you, because you need to understand what the medical term means by recognizing the medical term. When you get out into the pre-hospital setting and you're bringing patients to the hospital, they're not going to talk to you like you don't know what you're doing. They're going to expect that you know these terms. Okay, perfusion is blood going round and round, oxygenated blood going round and round, giving the nutrients and oxygen the body needs to the cells. Okay, that is perfusion, and then taking that waste from the cells and bringing it back to the heart and lungs to get rid of it, and bringing it to like the liver and the kidneys and all those organs that process waste. Okay, so that's what perfusion is: bringing the nutrients and oxygen that our body cells need to them, and then picking up waste and bringing it to the correct places so that it can be disposed of. Okay, so here's a picture. Here we have the upper body, and you see tissue cells. That's what's going to represent tissue cells. These little web-looking things are capillary beds. Arteries, arterioles, arteries. It's showing you blood going around. So basically, it's just showing you circulation from. Here's the left side of the heart. Blood leaves the left side of the heart, goes to the upper body, goes to the lower body, goes to the upper body and gives oxygen to the cells, picks up CO2, goes to the lower body, does the same thing, goes to the lungs, takes that deoxygenated blood to the lungs, dumps off the CO2, picks up oxygen, brings it back to the heart, and so forth. And you know, this picture looks really, really confusing, but It's pretty basic. Once you learn the blood flow of the heart, you'll understand perfusion more. But that's something you need to really focus on learning, is how blood flows through the heart and what perfusion is. And if perfusion is the carrying of oxygenated and nutrients to the cells that our body needs, then hypoperfusion, really quick lesson, hypo, it rhymes with low, so therefore hypo means low. And you'll have hyper. If you think about a kid is really hyper, they're really high end, they're doing too much. Some of you might say they're at a high level of activity. Hyper means high. Hypo rhymes with low, means low. Hypoperfusion, if we know what perfusion is, we know that means a low perfusion. That's a low amount of oxygen and nutrients being delivered to our body. If our cells do not get what they need, then they die. And if our cells die, we die. It's that simple. Okay, transport of gases in the blood. 97% of oxygen is carried attached to hemoglobin. 3% of oxygen is dissolved into plasma. Now, that being said, we only breathe in from the atmosphere, the environment around us, 21% oxygen. That is correct. 21% oxygen. 70% of carbon dioxide is carried in plasma in the form of bicarbonate. 23% of carbon dioxide is attached to hemoglobin. 7% of carbon dioxide is dissolved into plasma. Cell metabolism, my favorite. We have two types, aerobic and anaerobic. Before I go any further, aerobic, we think about doing aerobic exercises and we're doing good for our body. So when we're exercising, so aerobic is good, anaerobic is bad. Alright, click on the function that is most directly affected by systemic vascular resistance. Systemic vascular resistance. The function that is most directly affected by systemic vascular resistance. You chose diastolic blood pressure, you would be correct. Diastolic blood pressure is a function of systemic vascular resistance. Systemic vascular resistance is a function of the degree of constriction of the blood vessels. The greater the degree of constriction, the greater the force of blood within the vascular system between the contractions of the left ventricle. Alright, back to our case study. Kevin completes his primary assessment as Tom continues airway management and the assisting EMT continues to control bleeding. They package the patient and load him into the ambulance for transport. During the assessment, Kevin notices again how pale the patient's skin is and that it is cool and clammy to the touch. What about the patient's situation could explain his decreased level of responsiveness? What significance should the patient's skin finding have for the EMTs? Remember, you can pause this, write these questions down so that you can answer them as we go along. The nervous system. The functions of the nervous system. It controls and maintains a state of awareness, transmits sensory stimuli to the brain, controls voluntary and involuntary motor function, controls body functions through the autonomic nervous system. The structural divisions of the nervous system are the central nervous system and the peripheral nervous system. The central nervous system is going to consist of the brain and the brain stem and the spinal cord. And here we go. Central nervous system, we have the brain or the cerebrum. The diencephalon, which is the thalamus and the hypothalamus. Okay. The brainstem, which consists of midbrain, pons, and the medulla oblongata, or some people say the medulla oblongata, whichever you prefer. We also have the pituitary gland and the cerebellum. Don't get the cerebellum confused with the cerebrum. Cerebellum is different. See these little nerves through here called the tree of life. And then we have the spinal cord. So the brain, the brainstem, and the spinal cord make up the central nervous system. Don't forget, the spinal cord doesn't just stop here. It goes all the way down to our sacral region. Alright, the nervous system. We have the brain, spinal cord, and nerves. And highlighted in red is the central nervous system, and in yellow is the peripheral nervous system. If we look at this figure on the right, we have A. There is a hand about to grab some flame on a candle. That sensory neuron in that finger is going to say, ouch, that hurt, or it burned. It's going to send a signal to your spinal cord through your peripheral nervous system, and then a motor neuron, or that signal is going to leave your spinal cord and go down to a motor neuron in your bicep to pull your hand away. Cause that bicep to contract to pull your hand away. That's how it works. Pretty simple for EMTs. The functional divisions of the nervous system, the voluntary nervous system, which is, the voluntary means we can tell it to do something. I want to pick up a pen. I will tell myself, pick up that pen, and I will do it, and that voluntary nervous system goes to work. The autonomic nervous system is separated by the sympathetic and the parasympathetic, but the autonomic means we don't have to tell it to do anything. Meaning we don't have to tell our heart to beat, we don't have to tell our lungs to breathe, and that sort of thing. Okay, amongst other things, but those are the major ones. Here we go. Big old diaphragm of all the organs, all the main organs, and how they are affected through which nervous system. I'm not going to read all that to you because you can read, and that will take me an hour, and I'm sure you're ready to be done with this lesson. But you need to look at it. If you see the sympathetic is on the right, parasympathetic is on the left. It's drawing you a little line down the spinal cord. And you'll see the different signs and symptoms here on the right. And it will show you where it goes and what it controls. Pretty good information. You just gonna have to take time to look at it. Okay, consciousness and unconsciousness. It relies on the cerebral hemispheres and reticular activating system, or the RAS. The RAS is a group of nerves in the brainstem. Unconsciousness results if the RAS or both cerebral hemispheres are not functioning properly, which can be from a neurological effect. It could be from blunt force trauma. It could be from drugs and alcohol. Just depends. The endocrine system. So before I get any further, the RAS or both cerebral hemispheres not functioning will cause us to be unconscious. So if you ever see anybody unconscious, or if you went unconscious, you would know that it's either both of your cerebral hemispheres or your RAS was not functioning properly. Give you brownie points if you tell the doctor that. The endocrine system, made up of ductless glands that secrete hormones to regulate body functions. Hormones affect numerous functions in the body. You may have heard certain doctors called endocrinologists. They are specialists of the endocrine system. Some people go to be nurses, and they I have a friend who's actually been a nurse for a long time. She just went to be an endo nurse, and she works with an endocrinologist. And that's all they do is endocrine system. All right, the endocrine system glands are the pineal, thyroid, and the parathyroid. The adrenal glands, the gonads, which consist of the ovaries in females and testes in males. Islets of Langerhans. I know that's or islets. Some people say islets of Langerhans. It's a weird name, but that's the name they gave it. Pituitary gland and the thymus gland. And here they are, the endocrine system, starting at the brain level. The pineal, point to you where it's at. The pituitary gland, we talked about that earlier when we looked at the central nervous system. The thyroid, the parathyroid gland, right here in the neck. You probably know somebody that's had some thyroid issues before. The thymus, here. The adrenal glands, which sit on top of the kidneys. How do you know these are kidneys? Because they look like kidney beans. Bet you didn't think about that, did you? The adrenal glands, they sit right on top of the kidneys. Okay. Then you have the pancreas right here, the pancreas. And we'll talk about what the pancreas does later. Right here we have, in females, we'll have ovaries. And in males, we have testes. I will tell you that the pancreas regulates insulin levels. And we'll get into that the more we talk about diabetic emergencies later on. Okay, epinephrine and norepinephrine is given off by the endocrine system. Epinephrine, which is adrenaline, and norepinephrine are secreted by the adrenal glands. If you go back here and look, the adrenal glands sit on top of the kidneys. They produce many of the signs and symptoms of sympathetic nervous system stimulation. So let me let you read that again. They produce many signs and symptoms of sympathetic nervous system. The 4 basic effects are alpha 1, alpha 2, beta 1, and beta 2. Let me look at the notes here really quick. Let you see. Down at the bottom here, the notes for alpha 1. Let me get this. I'm getting there. Hold on one second. Alright. So alpha 1, one of the 4 basic effects, will give you vasoconstriction, which makes the skin cool and pale. Increased sweat production, which makes the skin clammy or moist. Alpha 2 regulates alpha 1 effects. Now, beta 1 increases the heart rate, contractility, and speed of cardiac electrical conduction. Now, if you look at beta 1, the number 1, how many hearts do we have? 1. That's how you remember it's a beta 1 effect, because it deals with the heart, because we only have one heart, beta 1. Beta 2 deals with smooth muscle relaxation and dilates bronchioles and blood vessels. Oh, well, so beta 2, how many lungs do we have? We have 2. That will give you what the beta 2 affects, the lungs. Beta 1, 1 heart. Beta 2, 2 lungs. Now we go back. Let me do this real quick, because my computer's weird. Okay. That's something that we're going to talk about more and more in the future, but beta 1 and beta 2, you need to understand that, okay? The integumentary system is the skin. It separates the body from the outside environment. The functions are to protect the body, regulate core temperature, serve as a receptor of external stimuli, like touching that flame, and it aids in regulation of water and electrolytes. Sweating. The layers of the integumentary system are the epidermis, which is the top layer, the outside layer, the dermis, which is the middle, and then the subcutaneous. And here we have the anatomy of the skin. If we look over to the left, we see the epidermis, then the dermis, and then the subcutaneous layer. And here we have a muscle fiber. So showing you right here, sensory receptors, the sebaceous glands, erector pili muscles. So that's going to give you like goosebumps. Hair, So you see yellow is nerve, blue is vein, and red is artery. And you can follow them up. Okay. And that's a basic anatomy of the skin. The sweat gland here. Now this sebaceous gland is going to give off sebaceous fluid and coat that hair. Okay. With sebaceous fluid, which is if some of you are excreting a lot of oil in your scalp, that is coming from all your sebaceous glands. Too much oil from the sebaceous glands. All right, the digestive system, it consists of the alimentary tract. I think I'm like Sherlock Holmes or something. Elementary. Consists of the alimentary tract and accessory organs. Functions to ingest and allow absorption of nutrients and eliminates waste. The structures of the stomach, pancreas, liver, and gallbladder. Spleen, small and large intestine, and the rectum and the anus. And this is pretty much in that order from the time we intake fuel to getting rid of it. And there we go, digestive system. We eat, salivate. Some of us salivate before we eat because like, ooh, that looks good. Goes down our esophagus into our stomach. And things are broken down through our pancreas, livers, and gallbladders, which help us digest. Then it goes into the colon and the small intestine, and then we excrete it from our body. I will tell you right now, there are two things that bother me. I have a pretty strong stomach, but it's other people's fecal matter and the bodily fluids from childbirth. Just disgust me. So we have two processes for the digestive process. The mechanical and the chemical. The mechanical is going to be your intestines moving the substance, the food through your body, through the intestines, and it's literally smooth muscles constricting and relaxing, contracting and relaxing, pushing everything down. And then the chemical digestion is going to be that your intestines are absorbing those nutrients and sending it to the different organs that need to process it and give it to the body. Kind of a complex system that we have. We don't realize it every day. Okay, the urinary or renal system. Filters and excretes waste to maintain balance of water and other substances. The main structures of the kidneys, ureters, urinary bladder, and urethra. And here's our urinary system. And here we have a kidney. See these little pockets in here? Well, if any of you have ever had, I get pretty bent out of shape over this, by the way, because I've had 5. If any of you have ever had kidney stones, that's where those little jokers hang out right there until they get ready to leave, and then they, let me go back. And then they jump in here and go down the ureter, and when they move is when it hurts. Just so you know, I've done a lot of research on this, and I hate kidney stones. And it makes me so mad. Anyway, the ureters, which come from the kidneys, they start here and they go down from the kidney to the bladder. Okay, that's the filtered urine. And then in the bladder fills up, and then males excrete it through our urethra. Females, you excrete it through your urethra. Don't get them confused. Ureters and urethra are 2 different things. Some people say ureters. Sounds weird to me. Okay, the reproductive system. The male sperm and the female's ovum contribute the genes that determine the hereditary characteristics of an offspring. A fertilized ovum grows into an embryo, then into a fetus, and finally into a newborn baby. And there's the reproductive system, starting at the testes and epididymis, which stores sperm, or the of you men who didn't know. Okay, the epididymis. Then there's the vas deferens, seminal vesicles, the prostate gland, the bulbourethral. I have trouble pronouncing that gland, and the penis. In the females, the breast, the uterus, fallopian tubes, not the fallopian. Don't be saying fallopian tubes. It's the fallopian tubes. Ovaries, the vagina, and the vulva. All right. Medical terminology. Now that we're done with anatomy. Medical terminology. Specialized language used in all fields of medicine. Complex words can be simplified with an understanding of combining forms, suffixes, and prefixes. Right here we see the word cardi/o. We see the root cardi. The slash and then the combining vowel and then a hyphen. So we can say cardiovascular. Yeah, or cardiology. Alright, so this is a table to help show you how to break down and understand medical terms and some examples. If we look, there's prefix, combining form, suffix, medical word, and meaning. I'm not going to read all these to you because you need to be able to read them yourself and practice pronouncing them. But I will go over a couple. If we look right here, the prefix hypo, below normal or low. Remember I told you hypo rhymes with low. Combining form, vol or volo, which means volume. Suffix, emic, pertaining to the blood. So each one of these has a meaning. The prefix, the combining form, and the suffix, they all have a meaning. So hypo meaning low, vol meaning volume, emic meaning blood. We put them together to form hypovolemic. We get a word that means pertaining to a below normal volume of blood. Low blood volume. I know you're probably like, geez, we just went over anatomy and now we're having to learn all these medical terms. Welcome to EMT. Hyper, remember I told you it was above normal, meaning high. Glyc or glyco, glucose, okay, sugar, and then emia, condition of the blood. Emic pertains to the blood. Emia is a condition of the blood. So if we put it together, hyperglycemia is a condition of above normal blood glucose sugar level. And that's where I'm going to stop reading those for you because you need to go back and you need to look at these and you need to study them. All right, case study conclusion. Kevin and Tom began transporting the patient to the closest hospital, 30 minutes away, and requested a paramedic to intercept en route, as well as notifying the hospital of the patient's condition. Upon reaching the hospital, surgeons immediately took the patient to the operating room, where they spent several hours repairing damage to the patient's liver, lung, femoral vein, and several blood vessels in the chest. All right, our summary. Knowledge of anatomy and physiology helps with understanding patient signs and symptoms and the treatments EMTs can provide. Anatomical terms and planes provide points of reference for describing assessment findings. Medical terms make up the specialized language shared by healthcare professionals. I will see you next time. Okay, retract that. I said see you next time. But I realized when we were done that we did this little quiz here, and when I clicked to return to the program, it missed a whole section, anatomical terms and planes and all that. Not that it's going to mess you up, that it's out of order, but we're going to cover it really quick and get it done because it's very important. And I thought something was missing, and I was like, wait a minute. So here we go. Back to the lesson. Anatomical planes are imaginary divisions that serve as a reference points So we have the sagittal and mid-sagittal planes, the frontal and coronal plane, transverse or horizontal plane, the midline, the mid-axillary line, and the transverse plane. And here we go. So see how the body is separated in these planes, and the reason they do that is so that you can take and in your mind cut the body in half with these planes and localize either your assessment or your knowledge of where certain things are in the body as far as organs and such. So the frontal plane, the coronal plane, is obviously cutting the body in half like this right here, and then the front is here, the anterior, which is the front, and then the posterior, which is the back. Then we have the sagittal plane, which cuts the body down in half in the middle. And we have the patient's left and the patient's right. And then the transverse or horizontal plane, which is right here below the pelvis, cuts the body in half. So we have an superior body and an inferior body. So again, I apologize for this, but it's better to go ahead and get it in. All right. So we see in this picture we have the midline, which is, this is going to be terms of direction. So this kind of gives us a direction of which way to go. The midline, straight down the middle as she's looking at us right there, down the sternum, the belly button, through the pelvic region. And we look right here, we see proximal. That's proximal to, proximal to the midline. Okay, and then distal is away from the midline. Then we have the palmar, obviously. And then when we say medial, we mean the middle. And then lateral, we always mean the sides. So if I tell you the left lateral chest, we are talking about the left side over here of the chest, which is going to be you have to move that arm out of the way and assess. So this will be the lateral portion of the chest right here. So in this, we see posterior, dorsal, which is the rear, the back of the patient, and then anterior, ventral, which is the front of the patient. So posterior meaning back, anterior meaning front, superior meaning above, okay? Don't ever forget that. And then inferior meaning below. So we, to give you an example, we could say the mouth is inferior to the nose because it's below the nose. And then this line is the mid-axillary line, and that's important when you go to learn how to put on EKGs, 12-lead EKGs. You need to know where the mid-axillary line is. And obviously this is the torso, okay? So just to give you some divisions and some direction. Here are the regions of the body. We have the head, the occipital region, the cervical region, and then the torso of the trunk, which we have the inferior angle of the scapula. Scapula meaning that is your shoulder blades, as we call them in layman terms. The lumbar region here. The iliac crest, which is that bone right there in our hip, in our pelvic, not our hip, but our pelvic region. Our flanks, which is if you ever have flank pain, you are dealing with kidney pain. Hopefully you're not having a kidney stone like I talked about earlier. They have the sacral region, which the spinal cord is going to stop right about here. And then we have the sacrum, which is part of the spinal region as well, but not the spinal cord. And then we have the buttocks. Obviously, you know what the buttocks is, especially if you've watched Forrest Gump, and he talks about getting shot in the buttocks. Okay. The lower extremities, there's your thigh and the lower leg, and then the popliteal region right here behind the knee. All right. So over here we have the arm and the forearm, the upper arm and the forearm. The thoracic region, which is our chest cavity. Our upper extremities are going to be our arms. And then we have the cubital region, which is the inside of our elbows. The umbilical region, which is the belly button region right there. So some of you know, but it's umbilical. When we cut the cord, when babies are born, we cut the umbilical cord. Okay, so if I say like the term umbilicus, I'm talking about this region right here to refer to that region right there. The inguinal region, right here, that little crest right here, you can also check for femoral pulses right here. You're gonna have to, that's the warm, sweaty pulse region. And I'm gonna let you figure that one out. If you ever have to check a pulse in the femoral area, that is the warm, sweaty region, pulse area. It's gross. The genital region, we know what the genitals are. Then that we have the femoral region, which is our femur. and then the dorsum of the foot, the top of our foot. All right. Here's the anterior chest, okay? So, also, I told you about the mid-axillary earlier. You're going to have to learn the mid-clavicular, if we know that this is the clavicle right here, or the collarbone, as you may call it. Well, if you split it down the middle with a line, that is the mid-clavicular line, and it goes all the way down the chest like that. The mid-sternal line, which is the sternum right here, we cut the sternum in half, we go all the way down the chest. That's our mid-sternal line. We talked about the trachea, and but we never talked about the suprasternal notch right here. I've seen my pulse right there before, right above that suprasternal notch. It's kind of weird. The manubrium and the angle of Lewis right here. And then the sternum itself. Remember, we don't want to go, well, there's the xiphoid process, the tip of the sternum. When we do CPR, we want to be in this region. If we get too low, we could break off that xiphoid process. Intercostal space, where you're going to be your intercostal muscles. And over here, pretty much the same thing, just without the exposed view. You need to learn those lines, those anterior axillary lines, and the mid-clavicular lines and the mid-lines. Here's the back. The mid-spinal, mid-scapular, because we're looking at the scapula and not the clavicle, the mid-scapular line. And we don't forget these shoulder blades, are technical term for them is scapula. Here we go. The lateral chest. Remember I told you the lateral means the side. So we have the posterior axillary line, and then we have the anterior axillary line. The mid-axillary line is where we're going to use to listen to lung sounds. No way. And also put V6 of an EKG. Okay? And here it is, not exposed. Topographic anatomy. I can read all of these body parts to you. I need you to read them. I need you to study them yourself. Let me go over some things that I know you're going to see again. Eye orbit, maxilla, mandible, clavicle, humerus, cranium. We know that's the head. The mastoid process, sternum, xiphoid process. The radius and the ulna are in the arm right here, the lower arm. And then the humerus is the upper arm bone. The femur, the patella, the tibia, and the fibula. The calcaneus, your heel back here, okay? Coccyx, iliac crest. Obviously lungs, liver, gallbladder, pancreas, bladder, heart, spleen, stomach, kidney, small intestine, and large intestines. If you see the ones that are not darkened in, that means they're hollow organs. The ones that are darkened in are solid organs. You need to look at these. You need to remember these. Know where your anatomy is. Here are the main body cavities. Cranial cavity, which contains the brain stem, and the spinal cord. Well, it does contain the spinal cord, that's central nervous system, but they're also saying spinal cavity as well. Thoracic, the diaphragm, thoracic cavity, and then there's the diaphragm. The abdominal cavity, abdominal pelvic cavity, and then the pelvic cavity. Okay, the abdominal cavity and all the organs. Notice it doesn't show you the heart and lungs because they're not in the abdominal cavity. So, you need to look at this. You need to understand that, and they have it described right here, and they cut it in fours. So 1, 2, 3, 4. This is the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. So if you see stuff like RUQ, that means right upper quadrant, or LLQ, that means left lower quadrant. You need to know those organs in here. So I can read all of this to you, and I'm not. But you need to understand, I'll just read the right upper quadrant, that the majority of the liver is in here. The right kidney is there. The colon is there. Small portion of the pancreas is there. The gallbladder, that little green thing right there, is there. And the small intestines. Okay? But also, you know, down here it says small intestines as well. Over here it says small intestines. Over here it says small intestines. Because we know small intestines is in all 4 quadrants. That would be a smart assumption. Okay, so look at that, study it. All these figures you need to study. You need to look at that because you're going to have to know where they're at, especially on the test. All right, the skeletal system is a bony framework, contains ligaments and tendons, muscles, and connective tissue. The functions are provide shape and protects organs, allows movement, and it has storage purposes as well. 6 basic components of the skeleton: the skull, the spinal column, thorax, pelvis, and upper extremities and lower extremities. And again, there is the skeleton. I have said these words several times to you today or in this lesson, so you need to go back and study it and know where these are. That is correct. If you just ask yourself, do I really have to know all of these? Yes, that is a correct assumption. Okay, the skull. Do you really have to know the different parts of the skull? I can assure you, you will see it again. Frontal bone, parietal bone, temporal bone, the occipital bone, the nasal bone, the orbit, the maxilla, mandible, and the zygomatic bone, which is also your cheekbone. Spinal column. You have the cervical column, the thoracic column, the lumbar column, then the sacrum and the coccyx. Okay. There's 7 vertebrae in the cervical column. There's 12 in the thoracic and 5 in the lumbar. Then you have the sacrum, which looks like a big alien right there, and the coccyx, which is the little tip right there. Okay, the thorax. I've said these plenty of times. I just read them off to you. Sternum, ribs, humerus, scapula, ulna and radius, lumbar, thoracic vertebrae T11, lumbar vertebrae number 4, L4, just as some reference points for you. And here we go down to the pelvis, naming bones again, the sacrum, the coccyx, vertebrae L4, the ilium. This is the iliac crest right here, pubis. You have carpals, metacarpals, phalanges, and the ischium right here, and your femur. Lower extremities, I'm not going to read these to you, but I do want to go back and show you something. In the hand, you have carpals, that is your wrist, okay? Then you have metacarpals, which is the bones from the wrist to the fingers, and then your fingers are called phalanges, okay? Or phalanges, however people pronounce it from different parts of the country, I don't know. If you look here on the foot, you have tarsals instead of carpals, which is your ankle. Then you have metatarsals, like metacarpals, and then phalanges, which is your toes. The upper extremities, I mean, it's the same bones. It doesn't change, but you need to familiarize yourself. The humerus, the ulna, and the radius. The radius is that big bone on top where you check your radial pulse. You ever hit your elbow right there and you say, and it hurt and makes some kind of weird, like electrical signal through your arm, and you go, ooh, I hit my funny bone? Well, that bone thought it was humerus. Get it? The humerus? Okay, whatever. Okay, joints. Immovable joints. Yes, your brain, your skull has joints, but they're immovable. They will allow for expansion. Hopefully there's no expansion in your brain, because that would be a bad thing, but it will allow for it. Slightly movable joints, which is that those discs between your vertebrae, and freely movable, like your hip socket right there. Okay, joint motions. You have flexion, which is towards the body, extension away from the body, abduction, which is away from the body, and adduction to the body, circumduction, which is a twisting motion, pronation and supination, which is if you think of the feet, pronation is towards the midline, supination is away. The types of joints are ball and socket, hinged, pivot, gliding, saddle, and condyloid. Right here we have types of freely movable joints. There's the breakdown, the joint cavity. bones, ligaments, synovial membranes, and articular cartilage, which are all in these joints here: ball and socket, condyloid, gliding, hinged, pivot, and saddle joints. Bone injury. Bone is living tissue with a rich blood supply. Fractures can lead to bleeding from bone or surrounding tissue. Alright, bones have both arteries and veins, though only arteries are shown here. The vessels enter and exit through openings in the compact outer bone layers. They branch and extend throughout the marrow cavity and into the spongy bone at the ends. Because they are so richly supplied with blood vessels, bones can bleed profusely when fractured. The biggest bone in the body is the femur, so you would automatically assume that if it is broken, you're going to have a significant amount of internal bleeding. The muscular system. Muscles allow movement by contracting in response to nerve impulses. There are 3 types of muscles: skeletal, smooth, and cardiac. Cardiac is just the heart muscle. Here we have the muscular system. It's going to name all those muscles for you. You need to study this as well. You might know some of those muscles already, or you might know some of them as a different name, but it's something you need to look at. Alright, so we have a breakdown here. We have skeletal muscles, which are going to be out on the outer portion of your skeleton. Cardiac muscles is the heart. Smooth muscles are going to be in your blood vessels and in your airway. Alright, and that is going to be it for, I promise you that is going to be it for anatomy and physiology and medical terminology. Now that we've made up that escaped portion, I apologize, and now I will see you next time.